Hello, and thank you for joining us to learn more about models that shape better care. I'm Dr. Stuart Goldberg, Chief of the Division of Leukemia at the John Theurer Cancer Center of Hackensack University Medical Center, and I'm speaking today on behalf of the Association of Community Cancer Centers. I'm here to update you on the management of chronic myeloid leukemia and the use of tyrosine kinase inhibitors. The tyrosine kinase inhibitors, or TKIs, have revolutionized the way we think about cancer chemotherapy, and they have ushered in the era of targeted therapies. So how does a community doctor pick between these three medicines? All three tyrosine kinases are like a key. They fit into the lock formed by the Philadelphia chromosome fusion protein. And the idea is to get the right key to fit into that lock. Unfortunately, sometimes the lock will change its shape. One of the most common changes is the T315I mutation. This particular mutation makes all three keys no longer fit in. So if you have a patient who's not doing well, you want to look for a change in the shape of the lock. So send a genetic mutation analysis. And if it shows that it's changed its shape, you may need to think about other therapies. But fortunately, the lock doesn't change its shape that often. And most patients will do well on all three medications. And we are hoping that all three of these medicines will allow patients to become long-term survivors. It is important that we follow our patients when they're started on a second-generation medication to make sure that the patient is responding. Remember, it's not just the blood counts that have to get better, but we want to see that the cytogenetics and the PCR studies get better. If we don't see that our patients getting better, then we come in with our mutation analysis, which we'll talk about more in a future update. To learn more about treating CML in the community setting, please visit the ACCC Resource Center. And thank you again for taking a moment to learn more about models that shape better care.